For the past year, I've been working on Dr. Bethay's research team with Novant Health occupational therapists to examine how health literacy impacts post-surgical shoulder repair patients' comprehension and adherence to home programs. These home programs are given by occupational therapists to these patients during one OT session. This is the poster that we use to present our research, and I wanted to use it to explain our study to you. So let's zoom in on the content here. Health literacy is defined as the degree to which individuals have the capacity to obtain, process, and understand basic health information, which is needed to make appropriate health decisions and is related to positive health outcomes. So Novant Health OTs were wondering, does their current home program, is it written at an appropriate health literacy level for their patients to understand? If so, are they able to adhere to it once they go home and they're in their own natural environment? So this study aimed to explore those questions. We used a randomized two-group experimental post-test only design using a convenient sample. And we were comparing their original home program, their HP1, to a new revised home program, or HB2, which is rewritten at a lower literacy level and was based on the Pfizer principles for clear health communication. So you can see our research question. How does health literacy impact their overall understanding of their home program? And is there a difference in the level of adherence among those who received the original HP versus those who didn't? So as you see, our participants were recruited at 2 Novant Health facilities. You can see our inclusion and exclusion criteria in the left side of the page here. Overall, we had 28 participants, 15 males and 13 females, with a variety of education levels, the mean years of education being 15.1. 50-50 were split, as in 50 got the home program, 50% got the new program. Our mean age was a 69.9 with a range of 51 to 83. Some of the instruments that we used were the Flesch Reading Ease score and the Flesch Kincaid grade level, and that was to calculate HP readability and grade level, which you can see the difference between the two in this table here. We used the newest vital sign, an instrument developed by Pfizer, to measure health literacy level, and that involved reading an ice cream label, as seen right here. And to assess the comprehension of teach-back skills during the session, Novant Health OTs used an evidence-based technique called the teach-back approach, and they were able to document their performance using this assessment tool. Finally, after 2 weeks, we were able to call participants to follow up on how they're adhering to their home program at home. And to document that information, we used the Medical Outcomes Survey General Adherence Scale. So let's recap some of our main findings. Health literacy level ranged, with our average being 2.89, suggesting a possibility of limited health literacy among our participants. Here's a frequency table showing our MOS total scores, with the mean being a 5, which means that participants self-reported adherence to their home program most of the time. Whoops. And then finally we have our home program and the comparison of adherence scores. And as you see, there's just a slight difference. So going back down to our t-test to determine if there was a difference in adherence among type, there was no significance. We did find a positive relationship between health literacy and adherence, and a negative correlation between health literacy and age, meaning the older participants were, the lower their health literacy levels were. So what are some of our general findings and conclusions and relevance to the field of occupational therapy? It may seem obvious that higher health literacy does impact how well patients adhere to home program instructions. These findings coincide with other research that has been done. Similarly, older participants typically have lower health literacy levels, and these findings also coincide with other research. The minimal difference in our adherence mean score suggests that the home programs may were initially written at an appropriate readability level, and now OTs at Novant Health can have this information. Our findings are going to contribute to the growing evidence of health literacy research and understanding how these levels could impact comprehension of health-related materials. Our study was limited in our sample size and population diversity. We used a non-standardized self-created instrument for measuring teach-back comprehension, and we were unable to collect data for a longer extended period of time. In conclusion, we can determine that our home program adherence is dependent on more than just health literacy and more than just document readability, and future research should investigate how other factors like age or years of education might play a role in understanding health-related materials. If you have any additional questions on the research, please do not hesitate to contact me.